Hello. My name is Carmelo Graffagnino. I'm a neurologist at Duke, and I take care of patients who have strokes, both here in the United States as well as in Kenya and Uganda, where I spend some of my time. I want to tell you two stories, because these stories are real. The names have been changed, but the story is real, and this is something I see all the time, which is part of what drives my work. First story is a story of a lady named Jane. Jane's a 39-year-old lady, single mom, was pregnant, had a little bit of a rough time through pregnancy, but had a baby. And 2 weeks after her baby was born, she's at home with her mother, and suddenly, as they were having a conversation, Jane stops talking. Her speech gets slurred. The left side of her body becomes weak. Her face droops over, and she slumps over on the table. Her mother was very astute, and she had heard that this kind of thing could represent a bad thing going on, maybe a stroke. So she calls 911, and an ambulance comes. The ambulance notifies us at Duke that this patient's coming, and an entire team of physicians is waiting at the door for this lady. Within an hour of her symptoms, she's in the emergency room having a CT scan of her brain. This is a picture. On the left-hand side is a picture of the arteries of the brain, and you'll see that there's a cutoff compared to the right side. There's no blood flowing in the brain. And as we talk, 1 million cells are dying every minute. We took this lady to the angiogram suite, put a wire in the groin, ran it all the way in the brain, grabbed that clot, pulled the clot out, and totally restored blood flow. 4 days later, Jane's at home with her daughter and her mom, totally normal. I'll tell you a different story. This is Mary. Mary's a 55-year-old lady, lives with her husband, was having dinner, and as she went to pick up her coffee cup, she suddenly dropped it. Her hand goes to the side. Mary starts having trouble talking. Her speech is all off. Husband and kids are watching, and they're like, well, mom's been working pretty hard today. Maybe she's just stressed. Husband says, well, maybe we'll wait a little bit. She might get better. Daughter's like, what if we call the doctor? They get into a big debate, discuss this for 15, 20 minutes. It's like, well, maybe mom just needs to have a rest. So they put her to bed, give her a little bit of time to get better. 8 hours later, they go check on her. Mary still can't talk. Mary still can't move her right side. So they drag her out of bed, drag her into the car, and drive to the local hospital, which happens to be where I work. This is a CT scan of the brain, and for those that aren't used to it, that really dark stuff on the right side of the screen, that's dead brain. And within 24 hours of coming into the hospital, Mary's dead. So how could so much go right for Jane and so much go wrong for Mary? Let me tell you a little bit about stroke. It accounts for 1 in 20 deaths in the United States. And every 40 seconds, somebody's having a stroke. And in fact, by the time I get done my talk, 3 people in the United States will have died of a stroke. And where we live in the southeast part of the United States, we are 1/3 more likely to have a stroke than anywhere else in this country. If you look at low and middle income countries across the world, it's the number 2 cause of non-communicable disease death, so secondary or what we call chronic diseases. This is a picture of our country, and purple represents strokes, obesity, hypertension, diabetes, and poverty. And you can see this is exactly the same map. And that bullseye, that's I-95 and I-40. We live in the epicenter of stroke of the United States. I really love this because the question is, do we need more toys? Do we need more drugs? Do we need more tools to make a difference? And as Bill Gates says, the greatest advances is actually not in the discoveries, but how you use what you have and how you implement it. So what we're working on at Duke, and I'm going to share one component, which is the public sector part, but we are looking at a model for reorganizing entire regions and entire systems, which is composed of 3 parts. One is, who are the people you're targeting? How do we get the community engaged in getting the help they need, whether it's in prevention or acute treatment? Assuming they we can get through to that, how do we take care of them? There are millions and millions of papers. There's guidelines that are about as exciting as watching grass grow. So what we've done is we've built a playbook. Just like a football team, you have the NFL rules, but you have the Patriots playbook. It gets them over and over and over to the finals. So we've developed a very simple playbook that says, here are the best things you need to do for your system, your hospital, and provide it for free on the internet to anybody in the world that wants it. And then the third one is build a network of hospitals, emergency systems that are all actually connected to each other. So no matter where you're at, you have access. So these are the three cores of establishing a regional system: the community, the best practice, and the infrastructure. So how do we get the community? How do we get targeted education? Because what we've learned is that blind general commercials are not as effective as actual testimonials. If they were effective to that level, no one would smoke, our country would be lean, and everybody would be exercising daily. Because everybody knows that's the right thing to do. So we're working on going to the community, because in our country and across the world, access to healthcare is not universal. People intrinsically don't always trust the big medical systems and affordability. So what we're working on is saying, can we take our message to the community? So where does everybody go? Where do we go that whether you're rich or poor, black, white, Asian, Latino, young or old, what does everybody need? Grooming. So we are working in a partnership that we're putting together using barbershops and beauty salons to target both males and females of multiple nationalities and economic levels, and turning the barber into our health worker. Because you will tell your barber or hairdresser everything about your life. And if they tell you you need your hair half off on one side and on the other, you will probably listen to them. So we're going to use this opportunity to teach the teachers. And that's engage the hairdresser and the barber. First of all, what is their life experience? How has stroke touched them? Because if this is meaningful to them, it's much more likely it's going to be meaningful when they're sharing that. We're going to have a unified message. So this is a multi-phase program. Initially, we're targeting seeking help, recognizing it in yourself, recognizing it in others, and making sure you know what to do. So you don't do like Mary's family and debate for hours what the right thing to do is. You don't drag her into the back seat of a car and then go wait in the waiting room of a small hospital for the next 2 hours. You use paramedic EMS systems, which we know if you come by emergency medical services to a hospital, you will be treated at least 20 to 30 minutes faster than if you go by car. And your whole team is there, and the scanner's blocked. So everything works in your favor that way. So what is the message we're working on? So we developed this program called Be Fast and Pay It Forward. And these are little cartoon cards that are going to be available at all the barbershops. On the front side, it's going to have signs and symptoms of a stroke. And I would like you all to look at these and let's talk for a few minutes while we can. What are these symptoms? How do you recognize a stroke? And then once you know it, we're asking you to go and teach 3 other people. That's the Pay It Forward, just like the movie. And if everybody teaches 3 people who teaches 3 people, in less than a few months, our entire state would actually recognize this. So balance, sudden loss of balance could be a stroke. It's not always an inner ear infection, as everybody thinks. Eyes, loss of vision, double vision, droopy eyes, blurred vision, any of those could be a stroke. A drooping of the face, numbness of the face. Weakness of an arm or a leg, but we couldn't put L and make it sound cool, so we just went with Be Fast. So arm weakness, leg weakness, sudden inability to use part of your body. Speech, trouble talking, understanding, pronouncing, any of these things. And the T is that is the time to call 911, regardless of what the person feels. Even if your mom says, don't call 911, I don't want to go to the hospital. We're teaching kids, parents. And so what we're working on with this is, how do we get our barbers and beauticians to get this message out to their community, educate people on these things. And on the back side of this card will be a series of numbers, like get to know your numbers. Ultimately, we would like to have blood pressure machines, cholesterol measuring machines, and scales in the barbershop so you can assess your risk. But our first venue is to say, educate on the fact that it's a serious disease, how do you recognize it, and how do you get help? We have metrics now. We know exactly what's going on in our city, how many patients are showing up by ambulance, what time they show up, what neighborhoods are coming in, and we'll be able to look at the impact of a community-based healthcare program. This is not just referable to the United States. When I go back to Kenya this summer, my hope is working through the Moi Teaching and Referral Hospital, where I volunteer, to go to the neighborhood barbers and beauticians of Eldoret. Because if it works in the States, it can work in Eldoret. Everybody goes to their barber. So we feel that taking health to the community, engaging people that they trust, making this message simple and learnable and transportable is the beginning. We don't need new scanners, we don't need new drugs, and we don't need new fancy wires. We have them all. We just got to be able to apply them and apply them effectively. And so with that, I'd like to thank you all for your interest and time.